Hi everyone, and welcome to Alliance Live, the online information and learning portal showcasing examples of innovation and integrated working taking place across Scotland within health and social care. We continue the series of these 30-minute webinars focusing on what matters to you and the impact asking that question has had on the home care team at Glasgow City Health and Social Care Partnership. Julia Donaldson and Jill Schoolar from the partnership are today's speakers. For the last 6 years, Julia Donaldson has headed up the assessment team for the home care services with responsibility for the re-ablement and the monitoring and review of mainstream home care. Julia started her career spanning 33 years in health and social care as a community OT in South Glasgow, dealing with all care groups, children to older people, and gaining lots of experience of community care. Jill Schoolar is the project manager for home care services. Jill started her career 18 years ago in health as a molecular biologist at the Royal Hospital for Sick Children, researching treatment and monitoring of childhood leukaemia. Jill worked across some private science industry before returning to public service and spending the last 9 years working primarily in older people's community services. Jill mainly focuses on service development and improvement supporting the operations team. Finally, as the panellists deliver their presentations, we invite the audience to pose questions using the chat box, which is found within the toolbar at the top of your screens, or bottom, sorry. These will make up the questions for the Q&A session, which will follow on from the presentation and bring our webinar to a close. So without further delay, I'd like to pass it over to Julia and Jill.
Good morning, everybody. Thanks very much. So I've worked in care services within Glasgow City Health and Social Care Partnership for the last 5 years, coming up 5 years. And care services, when we talk about that, is part of Glasgow City Health and Social Care Partnership, which is the joint health and social care services within Glasgow. And when we talk about care services, we're talking about re-ablement services, supported living services, mainstream home care, and of course the community alarm service. Within care services, we have approximately 3,500 staff, those comprising of the community alarm team, the home carers, the management team, those that provide and fit equipment, the transport teams, administration and back office support, and the call handling teams. We have more than 25,000 service users in Glasgow who are receiving support from care services, which is a combination of those requiring support with home care, but also those who only are linked into the community alarm service support. Within the home care service, we have approximately 2,800 home carers delivering care to 5,500 service users in Glasgow. And that equates to approximately 87 to 90,000 visits in people's own homes every week. When we refer to home care, we're talking about visits to service users within their own home, multiple times a day, multiple times a week. We apply Glasgow City Council eligibility criteria. Service users are assessed and require support based on that criteria. And those types of support will include tasks that are essential to keeping people safe and well in their own homes. That includes getting people up and dressed in the morning, providing medication support, support with catheter or stoma care, management of continence, assistance to eat and drink and prepare food. And it's certainly not a care task that is what we would deem probably some time back as a domestic type of task. It has much evolved since then as the people and the profile of service users in Glasgow has become more complex, which comes with an ageing population. It's very much a needs-led service and centred on practical personal care tasks to ensure that people are safe and well. Very little practical non-personal care now, so shopping and housework is included for those that have other areas of support that are required. But it has changed and is not always what the public perceive as a service. The average service user age is 81, We support more females than males, a balance of 67% against 33% males. And the average hours that are provided across Glasgow for a person is 9.6 hours. In 2017, there was an average of 1.2 hospital admissions per service user per year. And within a 4-week period in Glasgow, the average hospital discharges into home care, we would support around 550 people home directly from hospital. We've got 9 hospitals in Glasgow, and the main referrals and support come directly from the Queen Elizabeth, University Hospital and Glasgow Royal Infirmary. We see approximately 113 to 120 community referrals into home care. So those that are not in hospital, but those that are supported via GPs, district nursing services, older people's mental health services, or indeed from concerned relatives, friends and family. We receive about 100 emergency referrals or reassessments of need, indicating crisis or where we require to respond to people's changing needs at short notice.
Okay, so who are our home carers and how do they end up in the role? So there's some rigorous sort of stages to go through before a home carer is able to go into somebody's home and provide these vital tasks of care. And it starts with a value-based assessment to make sure that the right personality traits and kind of right values and understanding for the role is identified right at the beginning of that recruitment process. Obviously then there's an interview with PVG and reference checks. Home care is now a professional registered profession. So home carers have the SSSC, that is the Scottish Social Services Council. They then have their own personal registration that they're responsible for, and that requires to be validated on an annual basis, and they require to have certain qualifications and have certain development opportunities to be able to maintain that. Within our own services, we have an 8 days, so that's 2 working weeks full of training before anyone is able to start the role. There's also some shadowing additional to that. So new home carers will be mentored by an experienced home carer, and they'll spend time with them learning the role and learning the policies and procedures and the way that we do business here in Glasgow. When our induction training has loads of core elements, so things like moving and handling and first aid, but also we include a dementia awareness as part of that, and that is a skilled level dementia awareness, which is a kind of acknowledged qualification. Once people are working, the training doesn't stop. There are certain core elements that are required to be refreshed every year, but there's also other development opportunities for our staff to access. So why did we look to do some joint working with Alliance? We were aware of Alliance and their work in the health and social care sector. Tommy's reputation was preceding him, so we knew what he was doing and what he was achieving was very impressive. Our head of service, Gordon Bryan, had worked with him previously in a role in South Lanarkshire. But when we looked at the materials and we saw what Tommy was doing, there was a really heavy presence of healthcare embracing this work, but there wasn't very much evidence of social care and care at home services embracing it. Now we saw this as a bit of a good opportunity for us to put our hands in the air and do some joint working. We also wanted everyone within our organisation to really take a bit of time and celebrate the contribution that we make every single day to people living with dementia and other long-term conditions and their families to try and make their lives a bit easier and a bit happier. We knew that we had a huge scope and reach as a big organisation. Julia's given you some of the statistics of what we do on a daily basis, so we thought that we would have a great opportunity to have a bit of reach to these people. And also we recognised it as an opportunity for our organisation to start an improvement journey to make sure that we're ensuring better outcomes for all of the people that are accessing our services. It's also a really good way for us to embrace and embed the HSCP vision and key principles to ensure that people are supported to live at home for longer. So what is our vision and key strategic drivers? Glasgow City HSCP have the vision to ensure that service users get the right support at the right time in the right environment. And we feel that we're really integral to the support of the HSCP in achieving this vision. Glasgow City HSCP have identified some key priorities in line with the national Shifting the Balance of Care agenda to really help all our services support them to achieve this vision. The 5 key priorities for Glasgow are early intervention and prevention of harm, providing greater self-determination and choice, shifting the balance of care, enabling the independent living at home for longer, and public protection. As a provider, we also need to make sure that we are providing services in line with the new national care standards, of which there are 5 headline outcomes for service users, which I'm sure you're all aware of. There's also a national level, the 9 national health and wellbeing outcomes for all health and care providers, and I'm sure you're familiar with them, but we need to make sure that all our development and all our provision of service very much embeds these principles. Looking specifically at some of the dementia strategy, we believe that this work really reflects the commitment 6 of the National Dementia Strategy, which is working in partnership with local stakeholders. The stakeholders in this project were Alliance Carers Voices, our own home carers and coordinators, our training facilitators, our administration teams, our call handling staff, technicians, managers across a range of 13 different care services that are supporting up to 25,000 service users every day. We believe that it reflects a house of care model, allowing health and care services to embrace collaborative care and support planning and fulfil our core objective as a care at home service to support people to live and die well in their own homes as much as possible. We've also got that ongoing commitment to our own staff to provide them with development and continuous professional development for their registration with the Scottish Social Services Council. And if they're already a registered person, then to ensure that they're able to validate their annual membership as they move through their career.
So what do our services tell us? Our services tell us, in consultation with our staff and our service user focus groups and our consultation that we do with our service users annually, that there is a desire to enhance our knowledge and skills. We know that from our supported living evaluation that 74% of the service users within that particular service are diagnosed with dementia. And I think more importantly for us, we need to be listening to our staff, and the consultation with the carers, particularly in the supported living service, recognised that they wanted to feel more confident in interacting with service users with dementia. Within the same service user group and families, they reported there was an improved quality of life with service users who felt the benefits of the social interaction that the carers deliver whilst providing care. Research has also shown that those 65 years and older want to stay in their own homes for as long as possible, and we need to ensure and invest in a workforce that is fit for purpose to meet those needs of an increasing frail demographic. So when we were working with Alliance, what were the things that we needed to consider? We have a range of staff groups: home carers, administrators, call handlers, technicians, occupational therapists, social care workers, supervisory staff and managers. We needed to think about the work patterns of all of those staff. A significant number work shifts that are 7 on, 7 off, out of hours workers, weekend workers, and office support and our occupational therapists and social care workers who are primarily agile workers. Staff are based all over the city, and home carers especially tend to work in small geographical patches, many of whom are non-drivers. We operationally have a service to deliver, and we can do this, but we still needed to have the realisation that staff needed to be released from their work patterns to be able to attend some of these sessions. We needed to accept and acknowledge that we wouldn't be able to reach everyone, but that this was the start of a journey, and we needed to ensure visibility and communication of how we can further deliver and improve. We started off by getting together a planning group, which consisted of Tommy and our key partners from Alliance, with key operational staff and managers from within our services. The planning group really started months in advance to try to drill down the detail of what was going to be required to deliver this. And our regular meetings delivered an action plan, and the key elements of which we were trying to deliver, what material and resources we would need, what our communication plan should be, and the themes discussed in the action plan were around the content of the sessions, the logistics, the marketing, the visions and the outcomes, and what materials we were going to require. Communication was a challenge. Our staff are not all PC facing and are working on a number of different shifts. So that certainly was a challenge. We decided to call our session a Tommy on tour, and that's how our headline marketing started off. We were fortunate that Tommy had given a commitment to work with us across 1 week. Although that was 4 working days, it was also considering the out of hours element to that. We had mixed attendance at sessions. We had deliberately decided on mixed group of staff, I think in recognition that really everybody has a part to play in looking after people in the community with dementia, and it doesn't really matter what your role is within that. I think we recognised that all people who would be attending these sessions would also have a personal aspect of this. They would know somebody, friends, family, or have been affected by dementia themselves. So the work wasn't just about that focus. Attendance was welcome from other staff sharing our premises, as we recognise that everybody might enjoy the sessions and get something from that. Key managers from the service were available at every session to introduce Tommy and ensure that staff understood why they had been invited to the session and why we prioritised time to deliver these sessions across care. Our overall key message was conceived in the You Can Make a Difference campaign by Alliance, and the sessions were around 1 hour long with time for questions and discussion after. Tommy brought his own very emotive delivery and powerful personal experiences to these sessions, which really resonated with staff.
So we obviously wanted to capture some of the good work that we were doing and thought it was really important to embed some evaluation in this process. And anecdotally, as we were going through this, we got a sense of the enthusiasm and the great reception that staff were having for these sessions. So on it, we did 2 points of evaluation. We did an evaluation form about the actual session itself with some key questions. And we also provided a sort of blank pledge card for staff to reflect and make their own personal pledge about what they could do that could make a difference. On that pledge card, we also asked what barriers staff could identify that potentially was stopping them from being able to deliver their kind of difference-making pledge. So we were really pleased to receive back 271 completed evaluation forms and 192 personal pledges made over the 15 sessions that were delivered. And when that was collated and analysed, we saw that 91% of all the respondents thought that the experience was very good. 84% strongly agreed that this session did have a positive impact on their work. 85% strongly agreed that all their colleagues should be able to attend. And 89% strongly agreed that the key messages were communicated effectively. Obviously, there was 192 individual staff pledges, and this is just to pick out a few to be able to show you, because there was some key themes really with all the staff, but they were all coming from different angles, different perspectives, because they all had slightly different roles within the organisation. Never using the word challenging again. I think that was something that people acknowledged. We might talk about people with challenging behaviour, and actually what a kind of disrespectful statement that can be. So when people were saying never use the word challenging, they meant in describing somebody or someone's actions or their behaviour or their attitude. A lot of it was about being kind and actually just taking a bit of time to listen to what people are saying and not go in with our professional hats on and dictate how conversations should go. We should actually listen more and be kind to people. They're going through a journey themselves. They have some issues and they just want to be heard. So it's actually that active listening. So all those individual staff pledges were collated as well. We thought it was really important to actually demonstrate to staff that we did something with this information. So we created quite a nice infographic poster that was colourful and displayed some of the key themes and the feedback that staff had given us. These posters were printed, so some big versions were available to put in our head office at Blair Court, across our learning facilities and some of our community bases, but it's also available as a PDF, which we made a point of emailing out to all staff so that people could see that and be able to see that we actually had taken cognizance of their feedback and it was worthwhile them filling in that form. Our individual pledges were also then made into leaves to populate our Dementia Trees and our What Matters to You trees that are all over our community bases, our learning centre and our head office. This picture here is our Dementia Week tree, which is populated in Blair Court, and this is a really busy link corridor, so this makes everybody walked past us, from our senior managers to our call handlers and our community alarms. And they walk past that every day, and it's an opportunity to just see those pledges and be reminded of them. That's just a close-up of some of the wee individual leaves. So, having asked staff what were the barriers, then we needed to make sure that we listened to that as well, because that was really important. So what could we do to support staff to be able to make a difference? And some of the key themes were really about actually opening up these sessions to more people, having more things like that with more specialist training, and having more time to work with people, more staff to be able to provide those services. So there were some things that we were probably expecting, but there were some other things, and it does sort of reiterate that listening more, because actually you think people are going to ask for the world, but they ask for quite simple things like, can we just have more of this, and can more staff be able to come?
So what next? All of our new home carers must complete an 8-day training induction before they're able to start providing care, something that Jill mentioned in detail earlier on. Tommy now has an hour session at each of those induction programmes, and I think probably to date we've seen about 400 staff go through those induction programmes. So for new staff coming into care services, they're starting their journey, hearing that very emotive talk, and hopefully carrying that with them as they go through their journey and career within care services. We employ roughly 200 new staff every year who will now all receive these vital messages as part of their core training. And all of those staff are so enthused that they love the roar sing along at the end of the session. The dates have been agreed throughout 2019-2020. On the What Matters to You Day on the 6th of June, we hosted our first ever World Cafe event with our frontline staff in the East End of Glasgow base, where we were joined with our Health Improvement Advisor colleagues from Health Improvement Scotland. And that really helped formulate some of our discussions about how we can use our learning and knowledge from the evaluation and from the sessions to ensure better care planning and outcomes for our service users. We picked the themes from the evaluation, and the questions that were added into groups we discussed, such as what does good care look like, what does a good day look like, how can we start a good conversation, and what do we mean by kindness. The interesting themes to come out of these sessions so far are the small things that staff realise about their own behaviour or that of others that sends messages out that we wouldn't want. So people spoke about not sitting down for a chat, taking time with our service users, walking into somebody's home, looking at their iPhone, looking at the next piece of work coming in, not taking their jacket off. These sessions will be replicated throughout the city, and our plan is to deliver the next session in the Northwest at the turn of the year. And we hope that we will be able to roll out the next session in March in springtime. All of the pledges and comments on the evaluation were looked into and embedded in the continuous improvement plan we have in care services, and that's really to ensure that our development plans have staff feedback and person-centred outcomes at the core. We're keen to further work with Tommy and Alliance, and we're thinking about making a film for our service users and carers to celebrate their relationships and be able to use this for training and as an initial prompt for conversations about care planning and improvement. We anticipate that this will help raise the profile of all the good work in the community services and the work that we've done with Alliance. Thank you.
Thank you very much.
That's great, thank you, Julia and Jill. That brings us to the end of the presentation section and onto the Q&A portion of the webinar. So we've had 5 questions come in that we've pulled from the chat box. The first of these come from one of the anonymous audience members. What evidence have you seen in front-facing staff that demonstrates that they are perhaps more confident in having conversations about what matters to you?
I think actually in the World Cafe event we saw staff reflecting on their own behaviours, and I think that that's a bit of a development for us because we've been probably in the past so focused on the operational delivery that we haven't really spent time, as we should have done, really engaging with our staff. And when we did the World Cafe event, I felt there was a bit of a shift and actually people were reflecting, and it was those wee things that Julia said, I don't take my jacket off, and what message does that send? And people were much more aware of that, and that then gives people the opportunity to just open up that relationship a wee bit more.
And one in particular anecdote was about a carer who said, "I now don't interrupt."
Yeah.
So quickly when I'm asking somebody how they are, I'm actually listening to what that person's saying. And I think probably not to say people didn't do that. It's just being more conscious of it and thinking about how you interact with people.
So that kind of leads nicely into the second question. This one comes from Twitter. Amazing evaluation statistics. Is there any other qualitative data you could talk about? What were some of the stories that you've been hearing from staff?
I think probably I would talk really from the supported living service side of things. So staff within that, I think originally from the evaluation of that particular service, and what led us on to thinking about the work with Alliance was that element of confidence and staff being a bit more relaxed. And I think just that wider knowledge of for instance, why individuals feel agitated. And Tommy was excellent when he was delivering his talk, really kind of imparting that message about, if you're going into somebody's home and they're agitated or abrupt with somebody, it's to think about why that might be. And so some of the carers have come back saying they're more tolerant, more understanding, I think, of the stress that unpaid carers are under. So I think that's really valuable.
And I think sometimes it's that establishing the relationship and the routine helps you. It's just like turning a lock. All of a sudden you have this much better relationship with, for both sides. It's easier for the carer to be able to go in and deliver the care, but the service user is much more comfortable, much more confident, and that can make such a big difference, because if somebody is agitated and upset and you don't develop that rapport and that routine, that's a really, really difficult task for each to get the good outcomes that we're supposed to be getting.
Great. So the next question comes again from our Q&A box. What are you going to do with the barriers that were shared? Can this learning be shared more widely?
Yes, absolutely. So the barriers have all been collated. Some of them might take a bit more work as an organisational kind of improvement plan. Some things were a bit easy fixes. We are happy to share. If people know who we are, we're happy to be contacted and can share things with people where possible. The improvement plan that we have just now has taken recognition of some of them, and some of the quick fixes we're doing around some of our care planning documentation and how we communicate with our staff about care needs and being person-centred. That is work that is ongoing, and they have really been embedded in that. Some of them we are sort of scoping out at present, and we haven't kind of started the work, but they are absolutely on there and being recognised that we need to address some of this.
And following on from that as well, another question from Twitter. Are you planning to share this learning from the What Matters to You sessions with other health and social care partnership staff teams? If so, how?
Okay, and I think probably the work with Tommy, we've already seen some of that work happening and from Tommy's discussion. So we've linked him in with the University of West of Scotland, for example, and I know that isn't the Health and Social Care Partnership, but actually what we do is support a lot of students who come out from the universities within social care, so occupational therapy students and social work students, and it's a really good point to start, isn't it, before you even, before you've got your first job, you've already had that experience of what care means to people. Some of the other authorities on the border for Glasgow, I think, have already made contact with Tommy directly to think about how they can then embed this, because they've seen a lot of the information through the work that Alliance have been doing. And I think probably closer to home, we've certainly got our own structures and meeting structures with our colleagues within the partnership, and have been talking about the work that we've been doing around What Matters to You. Certainly for the carers teams in Glasgow, this is going to be something exciting that I think they'll be keen to look into.
We're also part of a practice network, which is a national practice network, and a lot of the other HSCPs attend that. And we are all asked if we can put in some options for a bit of focused discussion when we meet. And there has been some interest expressed from that group about what we have done with our value-based assessment and our recruitment process, and also what we're doing. And that is a good platform for us to be able to share with HSCP and develop those personal links. That means that if they want more information, we can give that without bombarding everybody with our stories and our work. So there's a good platform there for us to do that.
Great, thank you. And so the final question we have, are you measuring whether staff are practicing their pledges? What do you think about this?
I think that the personal pledges were personal. We do obviously monitor quality in staff with workplace observations and things like that. I think if we identified that staff were feeling frustrated at being unable to deliver their pledges, then we would be interested to know why that is and how we could support them to do that. But the pledges are personal, and I think a lot of it was about quality, which yes, obviously we do monitor on a kind of organisational and individual basis.
And I think from my perspective, it's about the improvement journey and not losing touch with this agenda. So for me, the important bit will be about where do we take this next? I think the work that Tommy's doing with the induction programme is fantastic, but we do need to make sure that there's an opportunity for those home carers out there that didn't have the chance to attend. So that's Jill and I's focus next, is what do we do next about inviting those carers back that didn't have the opportunity?
Great. So that brings us to the end of the webinar. Thank you so much, Julie and Jill, for delivering a fantastic presentation and answering those questions. We hope it's provided some insight and takeaways to bring back to our audience's own organisations. Before we go, I just wanted to point out to some of the contact details and how you can get in touch with Alliance Live to perhaps showcase your own work from the project or an organisational standpoint. So feel free to get in touch using any of those contact details. Finally, a big thank you to everyone once again who registered and is listening to the webinar. We hope you can join us for the next one on the 14th of November, a week today, it's our NHS Grampian colleagues that will be joining us, who are leading on implementing the House of Care model and its principles into primary and secondary care. More information will be available on that in the coming days. Thank you very much.
Thank you.
Thank you.